focus that we think we need to work on in order to improve our service delivery of TB and HIV in Sudan. First one is the program improvement, in which we think that we need to recruit and retain more healthcare staff. We need to accelerate the implementation of the performance-based incentive scheme, improve the HIV and develop TB cascade performance, reinforce the TB HIV program integration, and expand the services to remote and emergency test settings. And this could be done through establishment of sub-clinics, outreach service delivery, and mobile services, and definitely the ART delivery points, which is one of the final strategies that have been introduced to HIV services during this war. The second key area of improvement is the testing and equipment. The first recommendation is to resolve the gene expert malfunctions and stockout, establish a robust sample transportation system for both viral load and TB sputum samples, to optimize the mobile VZT and high yield areas, not just to focus on the number of tests, but also to yield the highest positivity rates possible through different testing modalities. Also to expand the PITC and VZT, leveraging the high positive areas, utilize the missed testing opportunities in blood banks and screening of patients for surgeries and obstetrics and surgery departments in hospitals. Prioritize the prevention of mother-to-child transmission, despite the low positivity, but it remains one of the most important testing modalities in which we not only prevent the HIV transmission from the mother to the child, but also the partner of the mother, and improving the well-being of the mother. Address the high positivity rates in pregnant women. And referred cases, unfortunately, we have been observing a little increase in the positivity rates among pregnant women in certain states, like Red Sea states and Northern states. The third stigma area of improvement is the stigma reduction, of which we have we have talked about this certain area throughout our meeting, especially with the Sudanese Pale HIV Care Association, of which certain complaints that have been raised of the rejection of providing HIV services for certain patients. And the suggestion for improving or overcoming these challenges and stigma is to issue a high-level circular from the Minister to all health facilities to ensure that all PLHIV have the right to receive healthcare services in any healthcare facility in Sudan, increase the awareness of stigma and stigma reduction activities among the healthcare provider, speed up the recruitment of a legal advisor working with the SPCA or Sudanese Pale HIV Care Association to deal with these certain issues of legal issues of health service provision. Establish a joint committee from all partners to mobilize the resources and stigma reduction activities. To advocate and sensitize the integration of this component in existing activities like the PITC activities, for which we agreed that we should include the health human rights module within the training package for healthcare providers. The fourth area of improvement is the access to TB and HIV services. Starting with the first one, which is to expand the HIV services in states facing challenges in access to services, maybe suffering from IDPs, high IDPs influx, increase in the population movement and settlement, like certain states, Northern State, Red Sea, and White Nile. Address the gaps in TB service in mining areas at federal level to establish the TB facilities where possible, and meanwhile the areas needs to be targeted with the outreach and mobile services. Advocate for state level program needs with the state health ministries in appropriate forums like the emergency committee and health cluster and UNHCR meetings at state level. The final area of improvement is the health management information system. The first recommendation here is to continue the integration of HIV and TB information system into the DHIS2 with target to reach a full integration. Implement the DHIS2 training, and finally expand and dissemination of the monthly mapping report to all states. All these mentioned recommendations are supposed to be implemented as soon as possible, and with the help of different partners, of course SNAP and NTB, in addition to UNAIDS and UNDP, WHO and other partners. From this platform, I would like to ensure the importance of the high cooperation and coordination between different partners in order to not only increase the execution of GC